Hi, this is John DiMartino, President of Liberty Benefit Advisors, and today we're going to talk a little bit about the total cost estimator. Most of you are familiar with the budget modeling tool, a tool designed to assist school boards and employees with negotiations and finding a strategy that's mutually beneficial for all parties. But this is the next step. So once we've found that solution, we need to inform the employees that we in fact have a solution and they may benefit from it. So we talk in terms of total cost, and that's the amount of money that comes out of your paycheck and the amount of money that you pay when you go see a primary care physician or a specialist. Combining those two equals your total cost. Now, the next step is figuring out what each individual's total cost is, and we break it down into two parts. First is the fixed cost. And that's the amount of money that you're going to pay regardless of whether you see the doctor one time or 100 times. In this example, it's the premium annually is $12,000. The year 4 Chapter 78 contribution is 26%. And the fixed cost is to this employee is $3,120 annually. Now, the next step is figuring out what the variable cost is, and this gets a little bit trickier, but it comes down to what is your medical care level. I didn't just make this up. I grabbed these from the Affordable Care Act definitions. So at the lowest level, you may see the doctor once, maybe for a preventive screening throughout the year, and no maintenance medications are taken. At a medium level, we have about 2 doctor's visits a year. One of them may be for a specialist, 1 lab or diagnostic test, 3 prescription drugs, and $100 in other medical costs. And that could be more prescriptions or another doctor's visit. And at the highest level, we have about 11 doctor's visits, 5 lab or diagnostics tests, 19 prescription drug refills, that's at least 1 maintenance medication and 1 refill for antibiotics, for example, 1 day in the hospital and $9,600 in other medical costs, and those could be an inpatient procedure, an outpatient procedure, or anything in between. Now, once we broke down those 3 levels, we're ready to use the tool. So we create this and customize it for each entity that we represent. And in this example, we're taking a look at what the savings would be if an employee transitioned from Direct 10 to 2035, year 4, Chapter 78. So in this example, the employee makes $65,000 a year. They cover only themselves. They get 20 paychecks per year, and their year 4, Chapter 78 contribution is 29%. The next step is figuring out what their care level is, and nobody knows that better than the employee. And in this instance, we've selected medium, which means the employee will see a doctor a couple times per year. We project what the cost would be in the Direct 10 and the 2035. So in this example, their Direct 10 cost is $75, and their 2035 cost is $120. So the difference is $45. So his out-of-pocket expenses are going to be $45 more than they would have been in the Direct 10. And finally, we want to figure out exactly what the total cost is going to be. Is this employee saving money or spending more money based on that criteria? And here we can see that the Direct 10, year 4, Chapter 78 is $179 paycheck, and the Direct 2035 is about $137.55 per paycheck. So that's savings of about $42.28 per paycheck and $507.30 for the year. When we add in the extra amount they have to pay in copays, we find that the employee will be taking home $462.30 more this year than they did last year. Now, this is a great tool for any employee to make an educated decision as to which plan to select, but it's even better for negotiations because it's not just moving from Direct 10 to 2035, for example. There may be contribution changes as well. You may be rolling back to year 3 or year 2 or year 1 of Chapter 78 or some other type of contribution schedule in between that. And here's a video explaining differences between Direct 10 year 4 and the 2035 year 2 Chapter 78. In this example, we're projecting an employee's total cost if they transitioned from the Direct 10 at year 4 Chapter 78 contributions to year 2 Chapter 78 contributions for the 2035 plan. So in this employee, first we enter their salary. Let's put $65,000. What coverage tier? So let's do employee only. The number of paychecks they receive annually, let's go with 20. And the year 4 Chapter 78 contribution that they're currently paying, automatically calculates. Now take a look down here. This is where we take a look at the estimated copays and deductibles and coinsurance that the employee would pay in this plan based on their utilization. So we have employee only, so we only have to figure out the care level for them. And let's go with medium. In the Direct 10, we would expect that the employee would pay about $75 in copays. And in the 2035 plan, we would expect that they would pay about $120, the difference of which is about $45 that you can see reflected in red down here at the bottom. Now, taking that information, we take a look at the health benefits plan, so Direct 10 versus 2035, year 4 of Chapter 78 versus year 2 of Chapter 78, and the per paycheck contribution amount. That's going to be $179 in the Direct 10 versus $68 in the 2035. So each paycheck, this employee would be saving approximately $111. Annual savings would be about $1,300. And then we subtract from that the additional costs associated with the 2035 plan. And we find that this employee would have a net savings of $1,287.62. Wow. So you can see a huge incentive for both the employee and Board of Education to make a few changes to their plan design to deliver results that I think are fantastic. Over $1,000 in savings for a single employee, that's great. So in either event, I know many of you are coming up on negotiations, and we would love to be a part of them. You can connect with me on LinkedIn. You can give us a follow on Facebook at Liberty Benefit Advisors, or you can subscribe to our YouTube channel for more videos just like this. I'm John DiMartino, wishing you all the best.